morning. Today we're talking with Brent, a patient here at Pier 210 Dental Group. He has recently finished 5 treatments of NightLase. That's with our Photona laser, the LightWalker one, to be specific. And what it does is it significantly reduces the occurrence of snoring in our patients. Also, some people who have sleep apnea choose to do this treatment instead of having the CPAP machine. So we're going to give it a little talk with Brent today to see how it went for him. So Brent, I know that you started your treatment in May of this year.
Correct.
And you took a take-home study. What does that include?
So it's a unit you put on your head, and it has little sensors on it. It'll check your oxygen level throughout the night, and it records your actual snoring.
Okay, so do we get kind of a baseline from
Yeah,
that?
so it's a baseline, and it also introduced me to the fact that I had sleep apnea, which I
Okay.
did not know I had.
Okay, and how did that sleep apnea affect you?
I thought I was getting good night's sleeps, you know, but I was always tired throughout the day. I'd take naps.
Okay,
Low energy. I didn't want to do much after work.
okay. So you've had your 5 treatments. Tell me what the first one was like. What did you expect? Was it painful? Tell me about the process.
Yeah, so yeah, I thought it was gonna hurt. You know, you got a laser
Right.
going on your skin inside your mouth.
Right.
So, but it didn't hurt at all. I had a couple little, pinchy areas. But other than that, you really don't feel much at all.
Excellent. And I understand that it shrinks the tissues, so it opens up the airway,
Yeah,
right?
that's what he explained to me. It
Okay.
opens up all the airways. So, I used to have a problem sleeping with my mouth closed.
Okay.
So, I was really scared to keep my mouth closed all night, using a piece of tape.
Oh, okay. The mouth,
The
yeah.
mouth tape. And but after just the first treatment, my airways are so much freer, so I got a lot more air through. And
That's amazing.
Yeah,
That's
it was
amazing. And the doctor that we're speaking of is Dr. David Roholt
correct.
at Pier 210, and he's the one that does these procedures, right?
Yes.
Nice. So you finished 5 treatments.
Yep.
That's 5 times that you visited us, and he's used the laser to shrink the tissues.
Right.
And now, where are you in the process?
So now I have another sleep study I'm going on.
Okay.
So it's to kind of check where we're at, and I've noticed just myself that I get deep sleep at night. I stay asleep. I don't sleep with my mouth open anymore.
Right.
And my snoring is not gone, but it's so little that you can barely hear me.
That's
Yeah.
incredible.
Yeah.
So it's added to your quality of life, is what I'm hearing.
And my wife's.
Yeah,
'cause
oh.
She doesn't have to wear earplugs
Yeah,
anymore.
no,
So.
that's a good thing.
Yeah.
So your next sleep study, the one that you're doing now, will evaluate the progress that you've made,
Correct.
and then help you move forward with your treatment plan.
Yep.
Is that correct? And then I also know you had a comprehensive treatment plan, which included an oral appliance.
Yeah.
When do you wear that? What
So
is
I
that
wear
all
that
about?
every night, and what it does is it pulls my lower jaw forward, and it opens up my airway even
more.
Yeah.
Excellent.
Yeah.
Excellent.
So I don't take naps anymore. I'm
Nice.
not tired.
Yeah. Oh, we're really happy for you
Yeah.
on all of that. Tell me what you would say to a person who is thinking about doing it or hesitating about doing it. What would you tell a patient?
Oh, do it. Try it. I mean, like for my sleep apnea, if this wasn't available, they'd try to put me on a machine, right?
Right,
And
right.
who wants to sleep with a giant headgear on
Right.
every night
And clean it all the time.
clean it
Yeah.
all the time?
Yeah.
And my father had that thing,
Okay.
I don't think it made a difference, to be honest. He, I feel a lot freer. You put the mouth appliance in, you go to sleep. And I'm so used to it now that sleeping without it is really strange.
Interesting.
Yeah.
Interesting. Well, we thank you for your time today. We're
Yeah.
so happy that we've gotten such great results from
Thank
our NightLase. And we'll look forward to hearing about your progress.
All right.
Thanks, Brent.
You bet.